Okay. Let's go a little bit now to some of the principles. This comes from the White House website, okay? All right, first, as we said, so now we go back to what we said earlier. Their first goal is to control the rising cost of, basically they're trying to control the cost of health insurance is their primary goal. Medical care is actually the secondary goal because people mostly see the amount of money they're spending for insurance, but obviously medical care if you're chronically ill is an expense. But we've talked about that before. Massachusetts has shown what they're planning won't work. He says he wants to guarantee your choice of doctor and health plan. Well, 40% of physicians right now will not see a Medicaid patient because they lose money every time they do. That number is being approached for Medicare patients. I mean, if you turn 65 and try to find a physician, it can be a difficult thing to do because, once again, and with Medicare, it's not so much the money, because Medicare has a better reimbursement, but it's just the hassle factor. There is so much paperwork that you have to fill out for the Medicare process. And the other thing is, every day you see a Medicare patient, you take your family's life into your hands because the rules are so complicated that every day you're probably committing fraud if they decide to get mad at you, want to come and get you. And a lot of doctors just don't want to live with that. So they say, it's just not worth it. There's a gentleman, an anesthesiologist in Oklahoma City. He runs a same-day surgery center, and he doesn't accept any third-party payments whatsoever. So, for instance, to get your hernia fixed, if you have no money whatsoever and you just, no insurance whatsoever, you just say, I'm going to pay for this. The price is $2,200 for everything. Surgeon, anesthesiologist, recovery, anything you can imagine, complications, everything's included in that price. That's not a bad price. He refuses to he doesn't participate in Medicare, so he could legally take Medicare patients and accept $2,200 because maybe they liked him, they wanted to use his services. He refuses to even accept them because he doesn't even want to be close to the Medicare program and have any problems with being accused of fraud or issues. Now there's a gentleman that is completely outside the program and he still operates trying to stay away from it. So your ability to keep your own doctor, I don't know, once you start putting all these rules and regulations in place, you might find that a lot of people are just saying, I just don't want to participate with this anymore. And a number of doctors around the country are just saying, forget the third parties, my office visit's $35. Actually, that's a Rockford physician. And you just pay him at the time of service. And you say, thank you very much. And you get absolute privacy because your data doesn't go anywhere. Your information stays right there between you and your doctor. In 2013. And if you look at cost projections from the Congress, you see that there's not much money spent until that year. And that's the year where it becomes illegal to sell any insurance policy that doesn't meet the government mandates. In the first 5 years, you can continue to have your insurance policy, but say your neighbor says, I like your insurance policy, and that bill passes, your neighbor could not buy it. It would be illegal for them to buy your policy. You get grandfathered in, but no one else can join. So in essence, they're saying, we're not trying to destroy the private insurance companies. Remember, I'm not a fan. I just think they serve a purpose. But what they're going to do is limit their ability to sell their product. And then in 2013, my plan will not be allowed anymore because I have a high deductible plan. I enjoy it because I control my day-to-day expenses. If I want the dumb purple pill, I can buy it. I pay the price, but I can buy it. I don't have someone telling me, no, you've got to try this pill, that pill, and those pills. Even though everyone in your family's tried them, they didn't work. I need the purple pill. I'm sorry. The rules state you got to try all these others before you get to the purple pill. So that's the freedom of the health savings account. And my plan will go away in 2013 because it will not meet minimum benefits as stated by the H.R. 3200, the federal bill. He wants to assure high-quality, affordable health care for all Americans by creating this system that mirrors Canada or Great Britain. Well, interestingly, when Silvio Berlusconi had his heart attack and needed heart surgery, he didn't go to Cuba. Contrary to what Michael Moore tried to convince everyone, he did not go to Cuba. He came to the Cleveland Clinic. And one prominent member of Parliament in Canada took a lot of flack for this, but she voted with her heart. She got breast cancer, and she refused to be treated in Canada. She came to a hospital in California. So all these people around the world recognize where the high quality is. They're just not going to Great Britain or Canada when they want care. They're coming here. And in fact, Estimates show that Canadians spend about $1 billion a year on healthcare in the United States. One fun protest was someone from Canada said, Americans can't reform their healthcare system, otherwise what will we do? Next thing he always talks about is he wants to protect families from bankruptcy or debt because of healthcare costs. They're out there, oh, the medical care is causing all these bankruptcies. Well, if that's true, then the bankruptcy rate in Canada should be far less. In essence, but the reality is actually the personal bankruptcy in Canada is higher than in the United States. Not by much, it's like 0.3% versus 0.27. But if single-payer systems in this country were going to solve all these medical bankruptcy problems, we should be able to see it, and we don't. And then he always talks about investing in prevention and wellness. This is my favorite. What is, because I like to teach diet and nutrition, because I think it's the key to life. If you don't take care of yourself first, everything else is going to be very difficult. But what do they mean by prevention and wellness in Washington? Do they mean eat right and exercise, which is pretty cheap actually? Well, food can be expensive, obviously. But walking around the block every day is not a very expensive task. But what they mean by prevention is all the special interests will line up in Washington saying, fund my pap smear, fund my mammogram, fund my this, fund my cholesterol drug, fund my blood pressure drug. Those are medical therapies, but we're going to call those treatments. And where are they going to get this money? They're going to transfer it out of Medicare so that we can transfer it to all these, quote, preventive medicine companies. That is in the bill. I'm not making that one up. Some of these things that are going around the country are made up, but that is actually in the bill to transfer money out of Medicare to pay for all these special interest things that they're going to be known as preventive and prevention and wellness. All right, that's about it. Okay, so the last thing now is, what time is it? All right. I'll tell you, do you guys have any, let's ask some questions and give a break, because I've got one last thing that I haven't talked about is, now, I'm the first to say this, and don't worry, my wife is out in the hallway listening, and she will confirm it. I am not a genius. I have one of the world's loveliest and most charming and intelligent women in the world, and I'm very blessed, and so I say that out of fun, but trust me, she's a great lady. Anyway, I cannot solve the healthcare system. There's no one in this room that can solve the healthcare system as a group, but you know what can? All of us making our own individual decisions in our own best interests. There's no way in the world that you're going to have any bureaucracy in Washington that's going to come up with a plan for everyone. Therefore, what we need to do is to move away from centralized control to opening up the system to individual control. And now I've got ideas in that direction that might be a benefit, but when I talk about those things, trust me, there are lots of people with lots of ideas, and we need to give them all voice. We don't want just one idea to be the design for the whole country. So let's take a break and ask some questions, and then if you want, I can go over, as part of the questioning, I can go over ideas that will improve freedom rather than decrease freedom. Questions, and like I said, I've not covered how would I go about tweaking the system to improve freedom. So we can add that as part of the questions if you wish, but go ahead and ask anything. And Dr. Baptist, of course, is here, and he's a wonderful leader in this entire area, so he can answer questions as well.